Talking with Dr. Beck, who does nerve testing, physical therapy, and fixes anything from a strain to a stroke. So, Dr. Beck, I have heard that physical therapists help improve the golf game. How much bullshit is that?
Well, it depends on how bad your golf game is, I suppose. But people can frequently get better at their sports through directed exercise. And again, this is where we really need a therapist to look at very specific muscle strengths. For example, many sports, the key to being really excellent at that sport is to make sure that the muscles required to perform the critical elements of the sport are strong, they're flexible, and they're in good shape. Now, there's many other components to that, and that is the neuromuscular coordination that goes about performing the sport, and just the general eye-hand coordination that you need. And all these require a little bit different approach, and it can be very sophisticated. We have things we call plyometrics, where people are doing movement-type activities, and these all are usually directed by a physical therapist or an exercise therapist that can help you with that.
So, are you telling me it can help because you get a better, more precise body motion? Because obviously there's particular movements you need to get and go and be good at and be under control over it. So are you telling me yes, or are you telling me maybe, or are you telling me no, not at all?
No, I think it can. I think where the physical therapist really comes into play with sports performance is sports performance after an injury. You have coaches and exercise physiologists and people that work with normal healthy people acquiring the ultimate in their sport. But after you've had an injury, this is where I think a physical therapist can really play a great role in helping you return to that sport, doing it as well as possible.
Okay, but I'm talking about, a physical therapist. You had no injury, but your range of motion isn't what it should be. Somewhere along the line, physical therapy, will it improve your game? Be it tennis, be it golfing. I'm sure there's other I might even assume skiing, because you actually bent quite, anyway, can you guys, because, apparently you can check the particular nerves, the particular muscles, and strengthening a particular muscle or stretching a particular muscle so that it's supposed to be where it is. So from that viewpoint, it would make a lot of sense to me, and I have heard it many times. I think there are physical therapists out there who say, yeah, absolutely, and we do it all the time. So no injury, you think you can work on, if a person wants to improve a certain range of motion in his body, for whatever reason he might want to do that. Maybe it's a plumber who needs to bend his head under the sink to see things, and he says, I need to change my range of motion of my head. Would it be well off to come to you?
Well, it would be. Particularly if there's an underlying, let me just go back. Physical therapy can certainly help those, but if you have an underlying loss of motion or loss of strength, the therapist can really address those questions. The only thing I would warn people is that if you don't have a specific injury, it may be difficult to get your insurance to pay for the therapy. So just be ready, if the insurance company denies you. But yeah, I absolutely feel that the therapist can help with those conditions and improve your game if you have particularly underlying weakness or loss of motion in a joint or body part.
Okay. Good. So yes, obviously, if you feel that it is your motion, that your coach tells you, turn more, turn faster, turn stronger, and you kind of have a hard time doing it, go and see a physical therapist.
Yep, exactly.
Wow, wonderful. Wonderful. Here we are. Okay. I don't play golf, by the way, so I wouldn't know. I just heard the rumors.
Neither do I.